Welcome, everybody. This is Marise Frangie, the certified Create and Model Fertility Care practitioner, educator, and supervisor. We are here recording another episode from the testimonies from the book Woman Heal. And I'm so grateful that Becky Knapp is joining me for another episode today. Thank you so much, Becky, for being here.
Thank you for letting me be here with you. It's a joy to be able to share this news with women.
Thank you. Thank you. So today we are reading a story from the section of infertility. We're reading, in case you have the book, page 71. Physician Finds Answers Without Artificial Means by Teresa Schumacher. Would you like to start, Becky?
I would love to. I have had menstruation problems for as long as I can remember, age 13 years old and on. I was placed on birth control pills by a local doctor to try and alleviate severe cramps. Unfortunately, I never had any relief from the severe cramps and the major premenstrual symptoms, and just learned how to live with them. When my husband Kevin and I began to try to conceive our first child, we had a difficult time becoming pregnant. I went to my regular OB many times, but she continued to assure me that sometimes it takes over a year or so to get pregnant. After 2 years of trying to conceive, we were finally pregnant, but the OB was not concerned that it had taken us 2 years. We were blessed with our wonderful daughter, Elizabeth, who was born on June 5th, 1996. She was born 3.5 weeks early, but she was in perfect health. In January 1998, Elizabeth had just turned 18 months old, and Kevin and I decided to try and conceive a second child. We tried for numerous months with no luck, so I went to see the OB once again. She was not concerned that it was taking so long and simply noted that we were able to get pregnant once, so not to worry about it. It would happen again. After 18 months of trying, I once again went back to the OB and told her very assertively that we were concerned and wanted to find out what was happening. At that time, she placed me on Clomid to stimulate ovulation. I was only able to be on the fertility drug for approximately 6 months. After that period of time, she took me off of it due to the possibility of being at high risk of developing ovarian cancer if I stayed on the medication too long. At that time, she sent us to an infertility specialist. We met with the infertility specialist in February of 2000 and told the doctor our story. She did several ultrasounds on me and felt confident that I was suffering from endometriosis. She scheduled me for a laparoscope in March of 2000 to determine if that was what I had. After the procedure, she informed Kevin that I did have a mild to moderate case of endometriosis and that she had lasered the majority of it out. She then thanked Kevin with the following comment: "Tell your wife thank you. It's people like her that keep me in business." Why we chose to stay with a doctor that would make such a cruel and hurtful comment is hard to explain. The only explanation is simply that we were so desperate to try and have a second child that we were willing to put up with this in order to achieve our ultimate goal. In a following appointment, the infertility doctor assured me that she had gotten the majority of the endometriosis, but wanted to make sure, so she placed me on Lupron and Depo-Provera. This medication was to place my body into fake menopause state, stopping menstruation. The theory was, if I stopped the menstruation, then the endometriosis would clear up, allowing us to become pregnant. She first gave me a 1-month injection, and then 1 month later followed it up with a 3-month injection. These shots were horribly expensive, costing around $2,500 total, and we had to pay 30% of the shots because the doctor was not a preferred provider. The effects of the medication were absolutely horrible on my body. I felt like I had developed arthritis in all of my joints. Getting out of bed each morning was miserable. It would take me about an hour before I felt like I could function properly. I also experienced hot flashes, but the worst were the constant migraines that I suffered from. Some were so bad that I literally had to sleep them off. Most unfortunately, this is many women's experience. With secondary infertility, they struggle so much that they will listen, and they're very happy to listen to physicians because their expectation is they are an authority and will be able to help them. But we know through research that Dr. Hildress has done that Lupron does not prevent or have any effect on endometriosis. It doesn't do anything there. So I'm afraid that many times history is going to look back on that and look at that treatment as very archaic and not effective at all.
Yeah. I was thinking as you were reading how the doctor, even after 2 years, was still not concerned. But when people are tried and using the created model fertility care system, if they try to select days of fertility for 6 months and they don't get pregnant, it becomes alarming to us practitioner and to the NAPRO technology medical consultant. Like 6 months, they wait for 2 years before they even start doing anything or being concerned about doing anything.
Yes, and many times the chart will have some reflection of maybe something that's going on. If there is no reflection of that, it may give us some direction as well. We may look at the male factor as well. So all of those things can easily be evaluated very quickly so that we don't lose time in being able to have to find out what's going on.
Exactly. And there's so many stories of couple who were using it to avoid a pregnancy and the problems were revealed and they were treated those problems and when we were ready to achieve a pregnancy, they were
Hmm.
able to do it because the problem wasn't there any longer. So
Right.
yeah.
Yeah, very much so.
After 4 months of being on the Lupron shots and having no results, we went back in for a follow-up appointment with the doctor. She informed us that it may take an extra 2 months to get pregnant, so we'd wait and see what would happen. After an additional 2 months and no results, the doctor informed us of our next option. She felt confident that we would be able to get pregnant through artificial insemination. We both expressed to her that we were concerned about the procedure due to the fact we would not be able to take part in any selective reduction. Once again, she felt very confident that this would not occur, and the worst that would probably occur would be twins, maybe triplets. We informed her that we would need to think about this since we were very concerned about the possibility of selective reduction. After numerous conversations, Kevin and I decided that we did not want to do this. I called the nurse to ask her what our other options were, and she told me that this was our best option and that we better make a decision soon because my biological clock was ticking and this may be your last chance to get pregnant. I had just turned 32 and I was highly offended by this comment and knew that we were not at the right doctor's office for us. Thank goodness a new friend had told me about Dr. Hilgers, and I called to find out how soon we could be seen. So after 2.5 years of trying to conceive and many heartaches and increased feelings of depression, we finally met Dr. Hilgers in November of 2000. Even before meeting Dr. Hilgers, the wonderful receptionist had scheduled us to begin attending the Creighton Model Fertility Care System charting method to learn how to begin to use the method in order to achieve a pregnancy.
In meeting with Dr. Hilgers, he stated that he first wanted to do a hormone study to see if I was having any hormonal imbalances. This study was based on my charting cycle, and there were approximately 12 blood tests that were performed during my one menstrual cycle. Dr. Hilgers also looked at the previous films from my first laparoscope and could clearly see that she had not gotten all of the endometriosis and that she had lasered barely any of it. He scheduled me for another lap in January of 2001. Through this procedure, he was able to determine that my endometriosis was severe and that he was only able to laser some of it and would need to do a full laparotomy. He had to surgically remove the majority of the endometriosis due to it being attached to my ovaries and my bowels, which he could not laser. In March of 2001, Dr. this performed this surgery on me, which is very similar to having a C-section. I stayed in the hospital for 5 days and had an additional 5-week recovery at home. Dr. Hilgers felt very confident that he had gotten the majority of it, but wanted to assure me that the endometriosis was not my only problem. I also suffered from an ovarian dysfunction and hormonal imbalance. This was the first time in over 6 years that a doctor could actually tell us what was wrong and not just continue to say that a pregnancy would happen or try to push all of the fancy infertility drugs and procedures. Kevin and I both really respected Dr. Hilger's honesty and his desire to truly solve the problem. Due to my hormonal imbalance and ovarian dysfunction, Dr. Hilgers placed me on injections of progesterone at certain times during my cycle, based on the charting method. Also, Dr. Hilgers continued to do numerous blood tests and ultrasounds to try to determine why we were not getting pregnant. So, when I look at the experiences that couples have sometimes, it can feel overwhelming to have the situation of infertility, to have it looked at, to have it evaluated, to see what's going on, and then to try to correct a problem. But especially when couples are ready to be pregnant yesterday. But I think it's so important for couples to be supported in these times, because not only is this impacting the woman's health right at that moment, but it has long-term consequences. So when Dr. Hilgers is able to diagnose and treat underlying causes, this benefits the woman and the couple, not only in possibly being able to achieve a pregnancy, but long-term health. And that's the overall goal of the Creighton Model Fertility Care System and NAPRO technology, to address these underlying health issues. The training of medical consultants and the medical consultant fellows, who are also trained in the surgical techniques that Dr. Hilgers has developed over the years, allow for these real solutions to be brought forward and for women to be treated as they should be.
Yeah, I definitely agree with you. And I want to add that the care that the women get and the support from NAPRO Technology Medical Consultant, it's like comparing black and white compared to fertility specialists. Like this infertility specialist told her, tell your wife thank you. It's people like her that keep me in business. It got me thinking about our own journey of infertility, where we met with the infertility specialist probably for 10 or 15 minutes, very quick. We will make your baby in the labs. That was the highlight of her conversation with us. When we met for the first time with NAPRO Technology Medical Consultant, Dr. Watson walked us through everything. It took 1 full hour to explain everything to us. I remember getting out of her office and feeling like I'm a human being. I'm being treated like a human being. She cares about me, not a dollar sign. So yes, unfortunately, it's very different.
Yeah.
I forgot where we got to.
Okay, in November of 2001, I informed Dr. Hilgers that we were almost done trying. After 4 years of constant heartbreaks, I knew I could not do this emotionally anymore. He informed us that he thought I might be suffering from a thyroid system dysfunction. He explained the disorder and stated that he would have me take a compound called T3. I would need to take this exactly 12 hours around the clock and would have to monitor my temperature and my pulse 4 times a day. Kevin and I decided to try the T3 compound, but we both decided this would be the last avenue we would pursue.
Approximately 2 months after I began taking the T3, I was a few days late starting my period. I did not even contact Dr. Hilger's office because I was so tired of having negative pregnancy tests and I knew I could not handle one more. However, when I called in my weekly temperature results for the T3 charting on January 3rd, 2003, Dr. Hilger's nurse asked me where I was in my cycle. I informed her that I was peak plus 19. She indicated to me that I might be pregnant and that I should come in that day for a pregnancy blood test. I informed her that I was hesitant to do this due to all of the negative results. However, she convinced me to come in for a pregnancy test. On my way home from work around 3:30 p.m., I stopped and had the blood test. The nurse informed me that they would still try and run the test today, but would definitely call me by tomorrow. Both Kevin and I had convinced ourselves not to get our hopes up due to all the numerous times that we had been so incredibly disappointed. The phone call came in around 4:30 p.m. that we were definitely pregnant and that I needed to rush back to their office for progesterone shot. I had been on the T3 for exactly 50 days when we conceived. Dr. Hilger's nurse, Linda, knew that Dr. Hilger's would be thrilled with our news. He was at the Rose Bowl game in California, and Linda called him on his cell phone to tell him the news. He was so excited. I can't even begin to explain in words how excited we were. All I could do was cry tears of joy. Our daughter, who was 5.5 years old at that time, was beyond excited. She had prayed for a baby brother or sister for many years. All of our prayers were finally begin answered, and we were the happiest family, and definitely felt like the luckiest one at that moment. That night was definitely exciting and very busy. We had our daughter call all of our family and friends to inform everyone that she was going to be a big sister. During the majority of the pregnancy, I was at Dr. Hilger's office 1 to 2 times a week receiving progesterone shots. I had a blood test done every 2 weeks in order to determine my progesterone level. Everything was going great and I was feeling good. However, when I reached week 22 of my pregnancy, I began having some contractions. Dr. Hilgers immediately placed me on Breathin, which is a medication to stop the uterus from contracting. I had to take this medication every 4 hours around the clock. The medication worked great and stopped the contractions for approximately 3 weeks. When I reached week 25, the contractions were beginning again, and I was placed on bed rest for 2 days. And Dr. Hilgers started me on an antibiotic IV 2 times a week. The combination of the progesterone shots, the IVs, and the blood test every 2 weeks to determine my level allowed our baby to stay in and continue to grow. The remainder of the pregnancy was difficult physically, but I was willing to put up with anything in order to receive our small miracle. Our miracle arrived 3.5 weeks early. Alexander was born on August 15, 2002 at 8:37 p.m. Alexander was 20 inches long and weighed 6 pounds 10 ounces. He was a perfect and a healthy baby boy, and he was definitely our second miracle from God. How beautiful. If she didn't have Dr. Holgers with her, she would have definitely not carried that baby to term.
Right, right. And the beautiful part about this is that physicians can recognize this. The other beautiful part about this is that sometimes when women, I've had encountered a couple of clients who maybe they begin to recognize they know what needs to be done so that they can maintain a pregnancy, because once they go through that experience, they don't forget. And so they're very empowered to be able to advocate for themselves, to call their physicians and help them to say, okay, these are the things that we know work, this is what needs to be done. And not no disrespect to physicians, but when the patient is informed and they are able to do that, it adds to the physician's effectiveness by being able to help the client by listening to them. So I think that women who understand and they realize and recognize the importance of progesterone, and its ability to help a pregnancy is just, it's so invaluable. When I first started teaching, many physicians just completely disregarded, except for Dr. Hilders and medical consultants trained at the Institute who had seen it in action. Now, today, I will say that the medical community is somewhat waking up a little bit more, and there are more studies that are out there available. They don't always administer the progesterone like we would normally expect, but it's little by little the truth is coming forth. So our little miracle is now 18 months old. As I finally take the time to put our story down in writing, as I write this, I recall as if it was yesterday all the pain and disappointment we went through for so many years trying to conceive a second child. Unless you have personally experienced infertility, you could not even begin to understand the tremendous emotional roller coaster that a person can experience, not to mention the impact that it has on the entire family unit. I cannot adequately express my disappointment and sorrow that our daughter experienced for wanting a baby brother or sister so badly, and it not happening for 6 long years. But the majority of my memories focus around the fact that we are finally able to conceive and experience the miracle of birth of our healthy baby boy. My words alone do not even begin to truly express how thankful we are for Dr. Hilders and the entire staff at the Pope Paul VI Institute for everything they have done for our family. Dr. Hilders is a very intelligent physician and a researcher who continues to strive to find the answers to help out his patients. Dr. Hilders is completely different from all the other infertility physicians in this area due to the fact that he does find the answers and will assist people in becoming pregnant without utilizing artificial ways. Dr. Hilders and his staff are truly remarkable people who genuinely care about their patients and their patients' families. We have received outstanding care from them, and I would highly recommend them to anyone who is having difficulty getting pregnant or experiencing a high-risk pregnancy. We will never forget what Dr. Hilders and his entire staff have done for our family. They will always hold a very special place in our hearts.
Beautiful, beautiful. How important it is to really spread the news about this work. We need
It
more
is.
women, more couples to know about this because there are real solutions to those real problems that couples and women are suffering with. It's not just making them babies in the lab, it's not artificial insemination. There is a problem and it needs to be treated.
Yeah, yeah, yeah. The couples that are able to have this encounter, they do completely recognize that they are valued for their own value of human dignity, and they're able to see that. And there are couples who are not able to achieve pregnancy, and that still is a cross for them to bear, but women do express comfort in being able to have answers in regards to they know what
Exactly.
was going on, they know what was wrong, and then for their bodies to be now working the way they're supposed to, even if they still have not been able to achieve a pregnancy. So in that case, we are able then to maybe encourage and assist the clients towards adoption, which is, again, a beautiful answer for people who are trying to achieve pregnancy, and allows them to be able to be moms and dads for
Yes.
children.
Yeah, it's true. We're not saying that it's 100% effective in providing with children. There's nothing 100% effective. We're not the author of life. God is the author of life. But one thing for sure, the care, the support, the answers that they will get from medical consultant, from the NAPRO technology medical consultant, will bring a lot of healing to them. And I can attest to that in our own journey of infertility. Even though we knew we had one problem and we were actually considering the in vitro fertilization, but the selective reduction and the whole process were like, no way, we're not going that route. And then we came across the institute, and thank God, as a result of that, I became practitioner and now educator, supervisor.
That's so
Even though
great.
in the eyes of the world, our journey might look not successful because we don't have children, but there was so much healing that took place in our life. We had all the questions answered. We can never look back at and regret and say there was something we could have done and we didn't do. We did our part and we left the rest to God, and we can see how He's bringing fruit to our marriage in a different way. God has a plan for each one of us, for each of our marriages. So that should not stop us from letting people know that this can be really helpful for them. This can really empower women to be proactive in taking care of their own health and different reproductive problems, and also in family decisions, whether it's avoiding or achieving pregnancy. Thank you so much, Becky, for joining me in this story. This is really a
Thanks,
beautiful story
Marise.
that
Yes.
touches on a lot of aspects, a lot of things that couples struggling with infertility deal with. And we hope that this will raise awareness of what the created model fertility care system and NAPRO technology are doing here to serve women, to empower women. And in any way we can assist you, please contact us. You have our contact information in the description box below. City of Lebanon, FCC.com is my website. And Becky, you are in which diocese? Remind me.
I am in the Diocese of Wichita in Kansas. We're in the middle, but we take up South Central and Southeast Kansas as well for our diocese, so serving that area.
That's great. And if you know couples suffering with infertility, I know this is a very sensitive topic and it's hard to go and tell people, oh, I heard about this. Maybe clicking that share button and sharing that video with them can help them get to the right resources where they can really receive assistance, receive the medical care and evaluation that they deserve. And don't forget to subscribe to the YouTube channel or the podcast channel. This is being broadcasted every week on Wednesday via YouTube, via Anchor, Spotify, Apple Podcasts. We want to spread this as far as possible because every woman, every couple deserve to know this information. So help us in spreading it. And don't forget to leave your comments, feedback, any questions you have in the description box below. Any final comment, Becky?
Just thank you so much, Marisa. Thank you for doing this. I think this is so great to be able to, this book is 18 years old, and it's so exciting to be able to hear these stories and then to say, these stories continue. There are thousands of couples who have benefited from the gift of fertility care and NAPRO technology, truly addressing women's health and providing a lifetime of beauty for them.
Yes, I'm sure if we were to recreate this book with all our testimonies, all of us, we would
Oh,
have
yeah.
many volumes, many, many volumes. So, yeah.
Yes.
You can purchase a copy of this book from the St. Paul VI Institute. The link is in the description box below. And this can be a great gift for a clergy, for engaged couples, for people struggling with infertility or different reproductive problems, or even for physicians who you think need to really get more educated on this topic. Thank you so much, Becky, for joining me for this episode. Thank you so much, everybody, for tuning in. Don't forget to leave any comments, questions, feedback in the description box below. Thank you for watching and have a blessed day.